Well, with COVID cases skyrocketing throughout New York State, no one is completely immune from the virus, including the person in charge of helping the state combat it. New York State's acting health commissioner, Dr. Bassett, is currently working from home. This is after she tested positive for COVID Monday. Rosanna and I spoke with her about how she's feeling and how everyone can stay safe this holiday season with the surge in cases.
You know, I had pretty mild symptoms, runny nose, a bit of aches, and yesterday I tested positive on a screening test. So I'm home. I'm actually feeling pretty good right now. And part of that, I've been reassured by the fact that I'm fully vaccinated and boosted. So I wasn't too scared, and I'm feeling pretty good right now. Thanks for asking.
Are there new protocols? I mean, let's face it, you're double vaxxed, you're boosted. You said your symptoms are mild. You feel pretty good. Now, under the old regulations, we'd have to isolate for 10 days. Do we still have 10 days?
We're looking very carefully at that. Of course, in the middle of this really remarkable surge in infections, not hospitalizations yet, but infections. We're worried also about having health workers on their jobs. So we're looking at it, but it still remains 10 days in isolation right now. We're looking at it.
Now, I know you were able to get that rapid test and you're still waiting on a PCR test. A lot of people in this situation that are feeling unwell are completely unable to do so right now. Yeah. What is your advice for them?
Well, New York State is, I assume you're talking about New York City, and I also worked to get members of my family tested yesterday. And I know that what you're saying is true, and you just have to walk around to see people online. And the state is sending 1.6 million tests, and 800,000 kits, there are 2 tests per kit, to the city, working hard to increase the number of testing sites. But this is a highly contagious virus, and I think that we really need people to be careful as the holiday season comes.
Certainly, especially since it's coming up in a couple of days. A lot of people seem to either be panicking, or some people are saying, what is the big deal? If I'm double vaccinated, if I am boosted, it's essentially going to feel like a cold to me. So what's the reason for panic?
You know, it's sort of rolling the dice to get COVID infections. We don't know what determines whether somebody gets what they call long COVID or not. You can be young and healthy and get long COVID. So the best thing of all is not to get infected. I think that I would be cautious with a situation that's still evolving. Period between, that it takes for one person to become infectious and infect another is like 2 or 3 days. That's what's behind this really rapid spread. So people transmit to others really fast, and they transmit to a lot more people. So we're seeing this literal explosion of infection where Omicron arrives, and we should expect it everywhere. I don't think we should take this lightly. As long as we don't know how serious it will be. But you're right, it's turning out that this is mostly mild. But as I said, I consider it rolling the dice. This is a really good reason to be vaccinated and boosted. And we still have too few people who are fully vaccinated and boosted.
I'm just wondering about mask mandate. Where do you stand on that, and where should it apply?
Well, as you know, the governor on December 10th, which is now, a week and a half ago, implemented something that we call the mask vax mandate. It was in the form of a determination letter that I signed, and I, of course, was in full support of it. What it means is that any public indoor space should either be a vaccination-only space, fully vaccinated, or everybody in there should be masked. So no more mixing. When you see somebody unmasked, it should be because you're in a fully vaccinated place. And presently, with such a rapidly transmitting virus, our estimate now is that approaching 40% of infections are Omicron, and it was just 11% a few days ago. So it's, when it's so rapidly spreading, I would use a mask as a recommendation, not a requirement, in many indoor places.
I know the WHO just kind of said that they want everyone to cancel Christmas. So your thoughts on that?
Well, I don't know. I don't think we can cancel Christmas. I'm not quite sure what exactly they said, but maybe they were talking about large indoor places. And of course, we have the vax or mask mandate that covers indoor places for home family gatherings.
I think people are frustrated because they've been told if you get double vaxxed, if you get the booster, if you wear your mask, you're going to be fine.
Right.
And you're the perfect example of doing all the right things, following all the protocols, and here you are in isolation with Omicron.
Right, waiting for my tests, my final tests. But let me say this: we haven't kept up with this virus. It's changed. The vaccine was directed against the initial strain or variant, as we call them, and then came Delta, against which the vaccine didn't work quite as well. Now comes Omicron. So far, all of the vaccines help protect us from hospitalization and death. And that is the key here. So I'm happy to be vaccinated because I'm protected against hospitalization and death. I would love to have a vaccine that would mean I would never get infected, but I do want people to understand that vaccines remain protective in the most important ways.
All right, we do wish her well in recovery. Coming up in the 8 o'clock hour, we talk to Dr. Bassett about whether quarantine regulations need to change in the face of a rapidly changing virus, especially in areas where a lot of people are already vaccinated.
So many important questions there.